what patient demographics are best suited for RPM?
All of them. I'll say that and then I'll clarify it, but I really think any patient is a potential candidate for remote practice management monitoring. The reason being, if you look at healthcare in our respiratory space, we're sort of in the infancy or toddlerhood of it, and it's good because we need these tools. But like diabetes, I mean, I was sitting at a hotel 5 years ago, and parents were looking at their child's blood sugar on the continuous glucose monitor that she was wearing in a different state. And so that is a perfect example of how parents were using real-time data with their endocrinologist to manage pediatric diabetes or type 1 diabetes. And so there's other fields that are in front of us, in front of the respiratory segment, as far as endocrine and other things like that, neurology. I think there's a lot of applications that we're going to see come along in RPM. Clearly, the scenario I just mentioned where parents are trying to help children lends very well, partly because of the smartphone and the linking of smartphone with tremendous amount of data and symptoms helps when parents separate from kids because the parent goes to work and the kid goes to school, or the parents work from home and the kid goes to school, or whenever they're disconnected, it allows. But I think of it with like my parents. My dad had a very significant neurologic issue, and I think we're going to see inroads in that segment with neurodegenerative disorders, falls, things like that. So I think there's a lot of applications that are possible. So we should be open-minded when we think about RPM. And I think patients are really understanding the connectedness feeling of RPM2, and they're going to come to expect it. So I honestly think there should be very sort of brisk uptake of this with clinicians.